Hi, my name is Finn, and I have dysautonomia, specifically postural orthostatic tachycardia syndrome, or POTS. I covered what that illness looks like for me in a previous video. I will link it above. Today I'm just going to talk about treatments for POTS, specifically like how I've responded to some of them and then other ones that are available. I'm currently at a spot in my treatment where we're not really sure where to go next because I struggle with a lot of it. I know that when I was learning what dysautonomia and POTS was, and looking into lifestyle changes I could make or things I could bring up to my doctor, it was helpful to go to things like YouTube or just like medical research. Today I'm going to be referencing this book. I think it's going to be flipped, but it's the Dysautonomia Project, Understanding Autonomic Nervous System Disorders for Physicians and Patients. Not sponsored, as nothing in this video is sponsored, but this book was really helpful in me understanding more about all aspects of the condition, as well as bringing stuff up to my doctor. The main lifestyle changes that you should make for POTS, I think every patient should make it. Again, talk to your doctor and make sure it's okay in your case. Every patient is different. My main lifestyle changes that helped me were fluid intake increase and salt intake increase. So for fluids, I personally get 3.5 to 4 liters of water a day. The target is 2 to 4 liters per day. It's about I would say, what am I having, 15, 14 cups of water. And it's really helpful to carry a water bottle with you everywhere. I have a nice 32-ounce thermo flask that I got online, but everywhere you go, bring that water bottle. And salt, I have 10 grams a day, which is the max. Again, talk to your doctor because sodium can be complicated in terms of if you have other heart problems. Personally, my heart's healthy. It's just that my nervous system that's the problem. Essentially, having this fluid and the salt together help you retain water or fluids in your body. I have a low blood volume, so when I drink more water and have the salt, it helps me keep that volume inside, hopefully getting more blood to my brain. Exercise is also super important. I personally follow the Levine protocol. It's pretty much the gold standard, is that what it's called, for POTS rehabilitation. Patients are often deconditioned. I know I totally am, because it takes so much out of us to exercise with exercise intolerance. The Levine protocol helps you build up your strength with strength training and then cardiovascular training over several months so that you're not making your symptoms worse. Again, I would talk to a doctor, especially if you have syncopal episodes or fainting, to make sure you are doing it in a healthy manner, but it is something to look into. Compression garments were also super useful to me until I developed an allergy to them. I personally used Jobst, Jobst, stockings that would go from your feet all the way to your abdomen, and I had the highest strength. It was a little rough, but it helped me get through the day. They do tend to be expensive. I've heard that I used to use just the knee length compression stocks, but I've heard those are pretty much useless in POTS patients, so I would recommend at least thigh high if you're going to invest in those. I've also heard of people having abdominal binders, or they'll have these compression vests in addition to compression stockings, because a lot of blood is going to our digestive system. But if you have stomach problems, then it can be difficult to have that compression. I know I can't tolerate it even if I wasn't allergic. Something I continue to do is like altering my diet. It's sometimes referred to as like grazing, so essentially you're eating small meals through the day. I'll like make myself a plate for lunch, and I'll eat it over like 3 hours, because if you eat like all in one sitting, for a lot of people, it's directing your blood flow to your stomach and then less to your head, and it'll give you lots of symptoms. And I don't really have time for that after I eat. Also, in terms of diet, electrolyte beverages can be really helpful. So when you're trying to get that like salt fluid intake, it's recommended that like half of your daily intake should be electrolyte drinks. Personally, because of my allergies and intolerances, I do not tolerate electrolyte beverages, but for years I did rely on like Nuun tablets, Nuun. They have like a coupon code for patients with chronic illness that need hydration, which was really helpful. You just have to like reach out to them to get that code. It's personalized code, and it's pretty easy. If you have any questions, just drop them in the comments. I also use something called salt stick potassium, which is a pill. It's an extended release like salt in one serving. It's about 500 milligrams. I rely on those as well. That's what my cardiologist recommended to me. That one's really helpful, and I will include links to those in the description. The Vitassium also has a coupon code. You just have to reach out to become a part of their Vitassium club, which was really nice because they're not very cheap, as no supplements really are, but I think the money for me, is worth it. Sleep is also really important, but it can be difficult to manage if you're chronically ill because of like, I run into painsomnia. It's not a technical term, but having a good like sleep schedule before bed, like a sleep routine. So like getting off screens for an hour before bed, not really using your brain as much. That's helpful to me, at least. There are also many pharmacological treatments or medications that you can use for POTS or dysautonomia. The most commonly prescribed is fludrocortisone or Florinef. It is like somewhat of a steroid. I don't remember what it's called, but it helps you retain salt so that you retain more water. I personally didn't tolerate it. It gave me some funky symptoms, but it is thought to increase overall blood volume. There is also Mitidrin, which is the second most commonly prescribed drug. It is an antihypotensive drug. I personally did not qualify for it because my blood pressure remains stable, but you take it like several times a day to keep your blood pressure up, not before bed though. I know that can be helpful for many people. I did try beta blockers, which is actually, they're used in like heart disease patients. They slow heart rate and lower blood pressure. I had to stop them because of allergies. If you experience anaphylaxis, it can stop the epinephrine or the EpiPen from working, and the complications were just too great. Also, I experienced some side effects, but things like metoprolol, propranolol, any of the LOLs can be really helpful in lowering your heart rate. SSRIs, or selective serotonin reuptake inhibitors, and SNRIs, or selective norepinephrine reuptake inhibitors, have been used to help like POTS patients. They're both typically used as like psychiatric drugs. SSRIs are typically for like anxiety and depression because they work with serotonin. But it is another option. And then SNRIs can actually they can worsen POTS symptoms, but in some people it has the opposite of effect of improving symptoms. Personally, I'm on an SNRI and I have been for years, and I haven't seen that it affects my POTS in any way. Like, I tried to go off of it, but it depends on the patient. And the last, I guess, treatment that I am aware of is IV saline or intravenous saline. This is what I'll get if I if I have trouble just sitting up because I get too symptomatic, and I end up in the ER, then that's what they'll give me there. It's essentially just a liter of saline directly into your bloodstream, and it helps increase your blood volume. It usually makes me able to just walk out of the ER, but it can be troublesome in patients with like EDS or HEDS because it does not help it like hurts your veins. My veins are weak, and it can get to the point where you're needing like a line directly into your heart, which puts you at risk for sepsis, things like that. But for me, in the emergency setting, it's really helpful, and we're actually trying to push for a more frequent treatment so that I don't have to end up in the ER every couple of weeks.